Hello, friends. Good evening. This side Dr. Simran. Today, I'm going to talk on role of physiotherapy in empowering people with disability. This is something I really wanted to do for the disabled people because people with disability are the most neglected people. Many times in our society, they don't have that privilege which we all have. Although they are totally, sometimes they are totally normal in their brain activity, but they cannot go in public. They want to go to the mall, they want to go to the hospital, they want to go for some basic requirements which everybody needs, but they are somehow underprivileged. To just boost up all of us, to have a helping hand to them, to give them a not a thought that, oh, what they are, but instead, yes, they can. Okay, I want all of you to gather together and build up an environment for the welfare of the society of disabled people. So today, we are going to start with this topic, role of physiotherapy in empowering people with disability. So today's talk, we will be talking about how our physiotherapy team is helping about us, about disability, about the physiotherapy role, about the exercise strategy, and I'll show you some live example and live cases, and then we'll summarize. So this will be the agenda of the talk today. First of all, I'm going to tell you something about my own self. I am Dr. Simranjeet Kaur. I am a physiotherapist and now a district head in IAP Mohali branch of Women Health. I have been working since 14 years at Sukhija Physiotherapy Clinic, Mohali. Over here, I have so many certifications. Every year, I add my basket some certification, and I have done studies in dry needling, osteopathy, chiropractic, physiotherapy, Pilates, dry needling, cupping, women health, yoga, diet, and many more. The reason why I'm studying more and more is because I have in my mind a passion to heal. And if you have a passion to heal, there is a zeal which makes us study more, right? So, with that thought in my mind, I want to empower all the society to have a different eye to look out on the disabled people and help them out in their day to day life. So let's gather together and let's talk on what is disability. Disability is basically which is making us weak in somehow either a physical activity, it could be any joint problem, it could be a sensory difficulty like touch pain, temperature, you are not able to feel, you are not able to see sometimes, you're not able to hear sometimes, and that is a sensory disability. Cognitive disability is basically the brain related things. If I am not able to judge what is happening around me, then that means it's a cognitive disability. If emotionally a person is not able to react, how to react in different situations, that is also a disability. It can be any type of disability, like for example, अगर कोई भी हम चल नहीं सकता, फ्रैक्चर हो गया, राइट, एम्प्यूटेशन हो गया, एक लिम्ब ही टूट गया, एनीथिंग विच मेड अ पर्सन lose his leg, his body part, okay, so that is a physical disability. सो एनीथिंग, आप सुन नहीं सकते, बोल नहीं सकते, आपको पता नहीं चल रहा है एक उंगली है, दो उंगली है, एनीथिंग विच विल नॉट, बिकॉज ऑफ विच आप वॉक नहीं कर पा रहे, यू आर नॉट एबल टू वॉक प्रॉपरली, you are not able to drive your car. So this is a kind of sensory disability. Balance disorder is there, okay? Sometimes cognitive disorder, that is brain problems. अगर कोई cerebral palsy का बच्चा है, he don't know how to walk. Sometimes he's not able to touch the floor properly. He don't know what to do. Although sometimes he understands what is the command given by the mother to the child, but he cannot express. Okay, उसे भूख लगी है वो बता नहीं पा रहा. So these kind of people who are not able to emotionally react to you or cannot just listen, these kind of people come in the category of disability. Our WHO has given a disability definitions. I'm not going to go into too details about the definitions, but anything which makes you less in your day-to-day function and which makes an eye capturing on you, like you are not able to do sometimes, you are highlighted, and sometimes it happens like the daily tasks which we all are performing, but these people are not able to perform. They are not able to go into the public just because of lack of problems, either physical or sometimes the environment is not friendly to them, like wheelchair access is not possible in many places. Even I heard a lady's interview. In that interview, that disabled lady was telling us that she wanted to go for a dentist appointment, but she was not able to go to the nearby dental clinic, but instead she has to go to far away hospital because the wheelchair access was not possible. So these kind of disabled people are facing so many terrible problems. Okay, so it's our if we can help them out, it will be no, a great help not only to the disabled people but to the society's welfare as well. Sometimes these people who are not able to walk but have great minds, isn't it? So we can use their mind to help the welfare of all over the country and the world. So disability can be orthopedic, like amputation or fracture. It can be neurological, like Parkinson's disease, cerebral palsy. Yeah, it can be from by birth also, like a person is born like that, or it can be traumatic, like spinal cord injury can induce a person to walk less or unable to walk, right? Yeah, anything which makes you bedridden, even sometimes, even in the cases when you are too needing support of somebody, you are not able to go alone outside, even in the last trimester of the pregnancy. A person is dependent, isn't it? That kind of things can be helped out with physiotherapy. And even the sports injury, sometimes a person is injured in such a way that some injury can lead to paralysis of the legs, and sometimes heart and lungs issue. These difficulties are sometimes visible, sometimes invisible. Visible things are the person is on the wheelchair, okay, because of lack of limbs or anything like that. But sometimes it is invisible disability, like the person is blind or some heart issue. Okay, so these kind of people needs your support. Our acceptance in the society is required. Okay, so we can have a different look by not popping their disabilities, but instead helping them out and making what is their right, to make them achieve their right. It's their right that they can walk, they can go for voting, they can go for anything which a normal citizen of the country can do. Okay, so these all their rights, they can be achieved if we go together and make some employments for them, helping them out to reach them out to a proper physiotherapy institute where they can be treated. So, what is disability? This we have come across. It can be physical, neurological, developmental, or sensory, some disorder, right? So, any injuries can be the cause. It can be genetic, it can be birth related, it can be traumatic, right? So, if we are not able to move independently in the society, the mobility is reduced because of pain, then we come into the category of disabled people. So, what is the role of physiotherapy? Now we come to the second part, that is the role of physiotherapy. Physiotherapy has a wide role, not only treating the person, but uh, also emotionally as a supportive hand, right? We can boost up confidence in the person. We can reduce the pain. We can go for the strengthening exercises. We can go for the sensory stimulations. We can go for coordination exercises, balance training, and making the person independent. So, to make that person independent, again to resume the life. अगर कोई भी फिजियोथेरेपिस्ट के पास आता है फिजियोथेरेपिस्ट उसका दर्द कम कर देगा, उससे ताकत, सारे शरीर में ताकत की एक्सरसाइजेस कराएंगे, उसको टच, पेन, टेम्परेचर, सेंसेस, उसको कहाँ पे ऊंचा है, नीचा है, अप टेक्सचर कैसा है फ्लोर का, दीज ऑल सेंसरी सिस्टम एक्टिवेशन कैन बी डन। कोऑर्डिनेशन एक्सरसाइजेस होता है कि ऑल्टरनेटिव मूवमेंट्स, लाइक लेफ्ट एंड राइट, एक बार लेफ्ट लेग उठाना है, एक बार राइट लेग उठाना है, ओके, तो ऑल्टरनेटिव मूवमेंट्स ऑफ द लिम्स, दैट कोऑर्डिनेशन एक्सरसाइजेस कैन बी डन। बैलेंस ट्रेनिंग, इफ यू कैन स्टैंड ऑन वन लेग, एक लात पे खड़े होना, चलना, फिर जगह का चेंज होने से वो गिरे ना, तो बैलेंस ट्रेनिंग इज ऑल्सो गिवन बाय अ फिजियोथेरेपिस्ट। इंप्रूविंग इंडिपेंडेंस एंड क्वालिटी ऑफ लाइफ, if that person can again resume the normal activity, जो चल नहीं पा रहा था चलने लग गया, if he is not able to walk and now he is walking on the own, by without any support, जो टॉयलेट नहीं जा पा रहा था पेशेंट और वो जाने लग गया अपने आप, तो these kind of things are really achievable with physiotherapy. So we should help out and make them realize that yes, they can do it, right? And in this, physiotherapist uses manual therapy, exercise therapy, machine treatments, and many equipments which make the person again reactivate the system which is stopped due to neurological weakness. Now, this is a video I wanted to share. This is a lady who came to our clinic with the disability. She was not able to walk, stand. She was on totally on wheelchair. Then we made her walk on the crutches, and just after a few days, she was able to walk independently. Yes, this is possible. Sukeja Physiotherapy. Okay. So at Sukeja Physiotherapy, we did this treatment for the disability to walk. But yes, every physiotherapist can help you and support in these kind of situations. So how physiotherapy works? Physiotherapist can go for movement of the limbs, any activation of the limbs. Have you seen जैसे कोई छोटा बच्चा है चल नहीं पा रहा है तो उसकी मदर उसे होल्ड करके दोबारा से चलाती है कि नहीं, तो सिमिलरली if we forget our action because of paralysis, what a physiotherapist does is they will reactivate that chain which chain of movement which you have forgotten. They will reactivate by again and again doing the movement. So passive movements can be done. Then active assisted can be a progression. सबसे पहले डॉक्टर ही सारा मूवमेंट कराएंगे. Then if they feel that person is able to do, एक्टिव असिस्टेड, थोड़ा जोर पेशेंट का, थोड़ा डॉक्टर का, लाइक एक्टिव असिस्टेड, एंड देयर आफ्टर दे विल गो फॉर टोटली बाय पेशेंट, फिर पूरा काम पेशेंट करेंगे. और उसके बाद व्हेन द पेशेंट इज एबल टू वॉक ऑन हिज ओन, देन वी कैन गो फॉर रेजिस्टिव ट्रेनिंग विद द हेल्प ऑफ वेट्स एंड रेजिस्टेंस बैंड्स. सो दीज काइंड ऑफ प्रोग्रेशन, देयर इज अ स्टेप टू स्टेप प्रोग्रेशन. Initially, the doctor will do. After that, doctor and patient mixed, and then totally by the patient. Thereafter, with resistance and weight. Okay. And then we can go for sports and balance trainings and advanced exercises. Right. So, this is a progression a physiotherapist knows how to do. Okay. With support, how to make them walk. Okay. With properly guiding them how to walk, how to strengthen, how to release the muscles. The physiotherapist have a different eye, by looking at the patient he knows which all chain of muscles are linked. If I'm limping on one side, generally people will see that if the limp is on one side, pain will be in the shoulder. Just that's it, what a normal person can analyze. But because of the shoulder pain, how your pelvic muscles goes here and there, how the weight shift on the opposite limb. Okay, that shifting and interrelationships. If one thing is not working, the other thing is there in the body which is supporting, isn't it? So that is working more. If my right hand is not working, my left hand is working more, isn't it? So, how to balance that? How to see that if one thing is working more and that is giving injury at what muscles, how to just release the tight muscles, and how to activate the muscles which are weak. isn't it? So these all things are done under the supervision of a physiotherapist doctor. The physiotherapist can just analyze and assess the patient, what kind of needs he has. So physiotherapy gives you benefits in increasing the range of motion. The person who is not able to raise the arms is able to raise the arms, not able to hold the crutches can hold the crutches now, right? They can give the strength to walk again. The person who was not able to take a side turn, but now with the help of physiotherapy, he is able to take a side turn, he is able to sit, he is able to go to toilet, like that. So functional training can be done. That is by telling them how to walk. The gait patterns can be told. Okay, how to lift up the first you have to touch the heel, then the toes. They will just divide it into the smaller actions. Instead of you start walking, they will say start with the heel touch, then put the weight on the toes, then simultaneously lift the opposite foot, like that. So breathing exercises can be guided by the physiotherapist. You know, if we cannot breathe, we cannot walk, isn't it? So if we can breathe more, there will be a support to walk, right? So breathing exercises are all the time very, very important. We are missing breathing exercises and balance training most of the time, because of which the person is not able to walk, right? So even in the walking, your lungs and hearts are supporting. Okay, your core muscles are engaged. Whenever you're walking, your one limb is in the air, one is on the ground. So balance is required. Okay, so balance training is very, very important. You can use gym balls for that, Bosu balls for that. There are plenty of physiotherapy equipments which are promoting balance. Then confidence building, the talk and the boosting up is required every day. And that is done under the physiotherapy department. Whenever he is coming to the clinic, he is going to the different environments, he is having a confidence in himself that yes, I can do it, right? So initially, some support is required from the family and the friends to bring the patient, or we can even go for some home physiotherapy treatments. Yeah, even the patient and the people nearby, the caretakers, can also learn how to make them exercises to make them do exercises to make them independent thereafter, right? All the time, if you are working for them, they will not be able to work, isn't it? So you have to make sure to go to the ways in which they are activating themselves, right? Today they are doing small jobs, then bigger ones, then totally independent, right? So our goal should be there, that yes, we have to make them independent, we have to make them feel their rights and achieve their goals. Okay, they should have goals. If the life without goals is nothing, right? They should not feel negative. They should not feel that no one is there and I'm not able to walk anytime. If there is a mindfulness that I can do, definitely the improvements are seen in the patients. So, strengthening exercises, if we talk about strengthening exercises, there are so many strengthening exercises for the people. If the lower body is paralytic, then we will start from the ankle, the legs, and then the thighs. There is a approach like distal to proximal approach or proximal to distal approach, depending upon whether it is a spastic limb or a flaccidity is gone. Flaccidity is like weak limb. It's just gone like this. Okay, weak. If the weak limb is there, then we have to activate, contract. Okay, but if the spastic limb, like paralytic limb, then our goal is to make them relax. Okay, whenever there is spasticity, we generally go from distal to proximal approach. Okay, and whenever there is flaccidity, that is weakness, totally loose muscles, then the opposite, right? So proximal to distal approach in that case. For example, if a paralytic person comes to me, half body paralysis, generally ये पूरा bend होता है, tight होता है, it's not opening, their hand is not opening, they're not able to eat themselves. तो फिर क्या होता है? In these cases, we will start from distal to proximal. Like from hand, we'll open the hand first, then the elbow, then the shoulder, right? So this is the approach which we will do slowly. If you are doing any action very, very slowly, it will just make the muscle relaxed. But if it is the opposite, like in some motor neuron disease or something in which flaccid limbs are there, okay, in some cases in which the muscle is totally no power and just relaxed, foot drop, okay, like that, totally loose muscles are there. In those cases, you have to activate that muscles. You can go for light touch, you can go for and different maneuvers like PNF activation techniques are there, like proprioceptive neuromuscular facilitation. In this, we go for functional training, diagonal movements. अगर हम मुंह में रोटी खा रहे हैं, diagonal movements. It is a diagonal movement to eat. Okay, to clean the toilet. That is also a diagonal movement. Okay, whenever a functional pattern is seen, if I have to keep something, lift something and put it on the shelf, I generally do from left to the right. Okay, so it is a diagonal movement. Diagonal movements make the brain activate early. So you should go for some exercises with the diagonal movements and strengthening with resistance band and different kinds of resistance band training is preferred than the dumbbell training initially. The things what the person can do in the sitting, first they are done, or if it is a bedridden patient, the same position in which he is comfortable is is the starting position, right? So exercises can be done in sitting also. It's not that always you have to stand up and exercise. Many things are possible in sitting. You can move arms, you can move legs, you can move the upper body, the lower body, right? So we can go for resistance training, dumbbell training, resistance band exercises. Many things are possible. So this is a video showing
Ready to transform your wheelchair workouts? Here's a quick 30-second exercise you can do anywhere. Leg raise with resistance band. Trains whole leg. Stretch resistance band to train chest and back. Stretch resistance band forward to train chest and forearms. Single hand raise trains tricep. Side hand raise trains tricep and lats.
So this is a exercise of wheelchair, which can wheelchair exercises which can be done in sitting. So these exercises are shown to you that yes, these can be done. And there are many pain management techniques which a physiotherapist can help you out. Pain management techniques like myofascial release, light fascia release. Now, what is fascia? Fascia is a thin layer which is from head to toe connected. Okay, if this if I'm just pulling it up, so this pull and is affecting my other parts of the body as well. Because it is a thin layer from head to toe, it is connected. If your shoulder is injured, many times you put more weight on the opposite hip, isn't it? If your shoulder is injured, you generally come with a shoulder complaint, but a physiotherapist will also check that that injury is making your which all area tight, right? So to elongate the whole body, the full body stretching exercises can be done. Myofascial release is a technique with the hands in which they just relax the fascia and elongate that muscle so that if we wear a loose cloth, okay, खुले पजामे में movement easy होगा, right? So if we wear loose clothing, our movement is so easy. So similarly, if our muscles are very tight, we are not able to move. Okay, many times we are not able to raise our arms. Many people, if I ask to raise the arm, they raise like this. But actually, this should be totally straight, isn't it? So, whole arm raise will come only if you are more relaxed in your muscles. And to relax the muscles, many manual therapy treatments like MFR, myofascial release, and many kind of massage releases, stretching, mobilizations, and electrotherapy treatments are given under the supervision of a physiotherapist. So your physiotherapist can give you different modality treatments for inflammation reduction, for pain reduction, for spasm reduction, which and even to stimulate. Okay, if a muscle is weak, there are maneuvers to stimulate that muscles. We are generally dealing with orthopedic neurological cases, but pelvic floor stimulations are also something which is really in trend. Sometimes people don't have the control on the urination. They are leaking out urine or in the bed only. Bedwetting is going on, right? They are leaking out fecal or the stools are getting leaked out. Okay. So in that cases, pelvic floor rehab is a boon to the society. A pelvic floor rehab physiotherapist can help you out in just activating the cycle of urination and stool passing in an easy way. If you have sexual pains, these kind of things sometimes are very silent, people don't tell. Okay, so these are also the possibilities in the disabled people. People with disability can be treated. They can have normal urine passing, they can have normal stool passing, they can go to the toilet again if they are given proper support with the physiotherapy and mindfulness, right? They should have the courage, they should have their mind activated that yes, I can do it. Okay, in the cases in which who are totally comatose, they have bed sores many times. Okay, so to remove their bed sores, the physiotherapy is done. To make them again into the sitting, there are passive movements done, there are weight shifting done, there are wheelchair transfer techniques which are told how to do, how to take care, and these all small steps can make a real difference in the people who are suffering from these kind of disabilities. So, balance training is something which everybody should work on, but definitely the people with disabilities, right? Balance training is important because in our lifestyle also, we are always bending on one side. Many times we are sleeping on one side, always on left turn or always on right side. And sometimes our office environment is also such that I'm moving more on right, less on left. Okay, I'm lifting a baby on one side, I'm carrying a purse on one side. So, this is also in our daily life patterns. But if a person is disabled, it is so many times extra in them. If one limb is absent, like I don't have my right leg, then I'm putting more weight on the left side, isn't it? So, my center of gravity is moved to the left. Okay, so have more chances to fall. To prevent that falling, many times in old age as well, if we hear about the patients or the clients in the old age, the most commonest injury is by fall. Okay, to prevent that falls, we should inculcate balance training, we should inculcate coordination training in them. Okay, अगर कोई भी बंदा चल नहीं पा रहा, कोई कोई है जो ओल्ड एज आते आते ऑल्सो नॉर्मल पर्सन ऑल्सो फॉल्स, तो किसी को कोई डिसेबिलिटी है, देन द सेंटर ऑफ ग्रेविटी इज शिफ्टेड, एक साइड पे गिर गए हैं हम, एक साइड पे हमारा पेट शिफ्ट हो गया है, एक साइड हार्ड है एक साइड सॉफ्ट है एब्डोमेन, तो उसे सेंटर में कौन लेके आएगा? सम और द अदर बैलेंस ट्रेनिंग. Okay, your core muscles engagement, your pelvic floor muscles engagement, they all should be taught how to activate their hip muscles, gluteal muscles, their urinary muscles, their balance muscles, their muscles which help them to stand, to walk, to evacuate their urine and the stool. So, these all muscular trainings, balance trainings can be taught with the help of a physiotherapy maneuver and done under the proper supervision of a good physiotherapist. So these are the sensory balance training and sensory activation, where to step. Okay. Sometimes, they are walking, but they don't know where they are stepping. To activate their mind, yes, where I have to touch, I should know. Then we can go for some cone exercises, color exercises. Exercises in the sitting can also be done. Sitting on the gym ball can also be done. So this is balance training and mindfulness, where you have to touch. Okay, you should know the texture, the different textured walk can be added. You can walk on the grass, you can walk on the hard steps, you can walk on the soft mud, like that. Okay, so we can go for some different texture walks, we can go for different points, we can mark 1 2 3 4 and you have to touch that point. We can go for uh, different activities in sitting, in standing, in lying. This all is according to the patient, what kind of help the person requires, right? Then this is a cerebral palsy case which I wanted to show you. In this, the child does not have balance, so balance training was inculcated at our clinic, in which the child was again told how to shift the weight on the upper body, on the lower body, to activate the core muscles, right? There are different things which can again improve their balance. They can make them sit again, they can make them stand again. Again, walking can be achieved. Many people don't know that physiotherapy works like wonders, okay, because of which they are always sitting in the one room all through their life. If we are closed in one room, what will happen? Our mind will not activate. We don't meet people, then we feel bad, isn't it? All the people around us are activating our life. So that activation can be re-achieved in people with disability only if they are given proper support of physiotherapy, right? So physiotherapy gives a real change in their body, real change in their strength. You all can go and tell people who are not able to walk properly to go for a physiotherapy session. Even in the old age, people who are so stooped, just like Parkinson people, they're stooped so much. Like this picture, the third one, this kind of walk is there, and propulsive gait, high steppage gait. Okay, person is putting the thigh too high. Waddling gait is just like left and right waddling. Okay, and scissoring gait in which your knee is knocking, putting one into the other. And there is a spastic gait in which the spastic full arm is totally spastic and your foot is going downward and your arm is getting so tight, half body is paralytic in these cases. So these kind of different walking patterns you should see all around. Anywhere you find these people who are not able to walk properly, you must guide them to go to a good physiotherapist. And again, they can achieve many times normal walk is possible. Okay, so you should guide them and send them to the proper physiotherapy centers. Now, this is something I wanted to share with you.
Abnormal gait. Did you know you can spot issues just by watching someone walk? Yes, you heard it right. Gym gait. Weakness, muscle fatigue or stiffness. Festinating gait. Weakness, Parkinson's disease. Hemiplegic gait. Weakness, paralysis on one side. Stoppage gait. Weakness, foot drop. Drunken gait. Weakness, cerebellar ataxia or intoxication. Pregnancy gait. Weakness, hormonal and weight changes. Trendelenburg gait. Weakness, hip abductor muscles. Sakkija physiotherapy.
So this was the video which shows different patterns of gait. Okay, so many people are not putting proper weight on both the limbs. Okay, they are limping to one side, and sometimes only one side hip drop is coming up. That means hip abductor muscles are not working. Sometimes your shoulder is getting dropped. That means shoulder elevation muscles are not working. Okay, sometimes your knees are banging into each other. So it is a scissoring gait. That means inner thigh muscles are too tight and outer thigh are weak. To support these kind of people who are stooped, who are putting weight on one side, who don't know where they are stepping, okay, or walking like a drunken person, right? They don't know how to walk, how to sit, how to eat. These kind of people can also be uh, a lot of change can be made into their normal lifestyle with the help of physiotherapy. So please go and feel that these kind of things are possible. So make some efforts to go for awareness for these people. So in this, we can also guide them gait training. We can go in the different pattern. We can go zigzag pattern, like tapes can be put. Okay, different kind of stepping, circular walk, figure of eight walk, U type walk, any different patterned walk, different texture of floors can be given to them to walk on them, to walk on the stairs, to walk on the normal floor. And this is a parallel bar on the left side shown. In these, they can hold the bar and then the proper touch can be taught to them, how to walk, how to make their life independent. If a person is able to walk, if able to go to the toilet, isn't it? These kind of basic requirements everybody wants, right? Nobody wants a life just totally on the bed, right? To make them functional again. What kind of thing, what you will do first and foremost? Of course, you'll go to the hospital and everything, but after that, you can tell them to move. Motion is lotion. You must remember that. that whatever movement is possible, you must make them do that. If we stop the movement, then what will happen? The thing what they are remembering will stop. Okay, they will. If even in back pain cases, I have seen many people that they say if you have back pain, don't move at all. It's not like don't move. It should be move in your comfort zone. Okay, that means you should move only in the pain free zone. But it's not that you are not moving at all. If you are making yourself bedridden because of your pains, then how will the stiffness go? The stiffness will go on the other joints and make you more stiff, isn't it? So I want everyone that motion is lotion. Taking that concept into the mind, you must move. Even in the normal people, but of course, movement needs some points to remember, right? What are those points? Whenever we are going for extra movements like gymming, like any physiotherapy sessions, we must start with the warm up. Okay, warm up is just moving the joints, light movement, passively done in the person with disability, and if the person is able to do, like if only lower leg paralysis is there, it doesn't mean that upper limb movement should not be done, right? So upper limb movement should be done. Then he should know that yes, this is possible, this is not possible. Okay, whichever thing is not possible, that is done with assistance. And whenever you are watching it, it's like a biofeedback. Your mind is getting activated how this movement should be done. And once you are doing it again and again, your mind develops some ways out. Okay, that again imprints in your mind, in your brain, the way how you have to step, the how you have to move your hip, how you have to move your leg. And that imprinting sometimes again and again, if you are using it, then person is able to sit, then walk, then run, like that. Everything needs practice, and again you have to repeat. So repetitions makes a difference. It doesn't mean that if you are not doing any movement and you are expecting that yes, I'm able to move, it will not come. For your goal to be achieved, you want to move, then you have to repeat again and again your exercises, your strengthening maneuvers. If you're repeating, this will help all the people with disability to re-achieve their normal lifestyle. So this is a success story I want to share with you. This lady required so many people to make her walk, to make her come to our clinic, which was downstairs. So she came with a lot of problem in the stairs, okay, with support. And then after the treatment, she was able to walk independently. If a person is able to walk independently, go to the toilet independently, it's really relaxing for their mind and body, isn't it? Just have a look. So in this case study, we just saw was the hemiplegic gait. And in this hemiplegic person, if done exercising properly, the mind is so comfortable and relaxed that yes, I can do it. They can walk independently. With the help of support and physiotherapy, this all is possible. In the cerebral palsy kit, sometimes they are not able to open their arms, but with physiotherapy, like the advanced taping therapy is done on this case. So with taping again, the achievement of hand opening was achieved. This is another case with severe back pain, was not able to move, was not able to walk, and was totally on support, on wheelchair. How they kept them and brought them was very difficult in that situation. From that down stage of their life, they again went to independent life. Just see the case study. This is how they came to our clinic. They were not able to stand. People were just coming all along. It was a severe, painful condition of the back. And just after the treatment, see how he is walking on his own. Although it's the antalgic gait here as well. So with the repetitions and exercise, everything normal walk is achievable, right? So this was a case study to show you that people who are not able to walk are sometimes easily walking after physiotherapy. But lack of knowledge is there that people don't go for proper physiotherapy sessions. See how the person on the crutches was not able to walk and after the treatment is able to walk, right? So all of these kind of changes can be brought with the help of good physiotherapy treatments. So you all should guide people that they should go for a physiotherapy session and not just sitting, and only medications sometimes are making you more dependent. Okay, if you have a straw and the water will flow easily into it, isn't it? But if the straw is bent, okay, if the straw is bent, what will happen? The water has sometimes blockage is there in between, isn't it? That blockage is wrong posture. If your posture is equal on both the sides, your center of gravity is in center, then even your medications will reach the right place easily. But if you are bent on one side, it is stopping up your circulation, it is stopping up your left and right balance, because of which you are not able to walk. So in any case, if you are on medications or not, your movement is required. If you are able to move, it's okay. If you're not able to move, you need assistance in movement. And that is what a physiotherapist will guide you how to move, how to go for the mobility, right? So in this, the practical training is also shown how to transfer a person, bedridden person or a person on wheelchair on bed, how to go for where to touch, where not to touch. If a person is just head is going down, what will happen? If you are holding, how to hold that person. If we apply a tape like this, that the tightness is there on the back side, then the head drop will stop. So this kind, where to tape, where to mobilize, where to touch, can be learned under the supervision of a physiotherapist. This is how a person from wheelchair transfers should be done. Person who is transferring should be close to the body, just hugging like that and lifting the person and then rotating and transferring on the bed. This is a maneuver in which your back pains will not come. Okay, so with this we will just close today's session. We'll go for some Q&A. So which condition is commonly treated by physiotherapist? If you see, stroke, cerebral palsy, amputations, orthopedic, neuro, gynae, everything. Yes, the person with physiotherapy can treat all of the conditions by helping them out to come out of their disability, right? So which technique helps relieve muscle tension and pain in disability? If you want to reduce the muscle tension, then myofascial release, resistance, or cognitive, which technique, or none? The right answer is myofascial release. Myofascial release is a technique in which you are elongating the muscular fascia. Okay, whenever you are doing some kind of movements in which your muscle is getting elongated, these kind of maneuvers can help the person to reduce the muscle tension, and this is a wonderful technique to make a person relaxed and just tone up the muscle which is too tight to normal tone, right? What is the key benefit of using assistive devices in rehabilitation? Assistive devices now enhance the independence in the daily activities, or improve the sleep, or boost the intelligence, or none? What is the right answer? The right answer is enhances independence in daily activities, right? The key benefit of assistive devices. Assistive devices कैसे होते हैं? Like, if you know, assistive devices, it can be any kind of prosthetic, like anything which is giving you support. Okay, like in back pain cases, the belt, what we wear, lumbar belt. These kind of assistive devices will make the person independent. It will reduce the pain. Okay, it will support the person to walk. So these kind of assistive devices are also very beneficial to these people with disability. What is the goal of balance training in physiotherapy? Why we go for balance training? To centralize the COG, isn't it? It reduces fatigue, it improves stability during the movement, or it increases weightlifting capacity, or enhances flexibility only. Actually, the stability, if your center of gravity is centralized, it will give you stability. And once your system is stable, it will give you more range of motion, more relaxation, less use of energy. If a person is on one side, it uses more energy. But if a person is straight, the everything is centralized, it uses less of energy. So it reduces fatigue also. But the most suitable answer is improving stability, right? What is the primary focus of physiotherapy in children with cerebral palsy? The people with cerebral palsy, the small children who are born like that, they are not able to walk, they are not able to sit properly, not able to eat sometimes. So these kind of people, what goal is there? We want to improve the motor control and posture, or we want the speech to come first, or we want weight management first, or none. The answer is motor control and posture. Okay, they should know how to move, they should know how to sit straight. Okay, how, if a person is able to sit properly, they can eat properly, they can move properly, that is the most wonderful thing for that person, right? And even the mother of the cerebral palsy kid. Okay, whenever we are treating cerebral palsy kids, we must go for some body relaxation or stretching exercises for the mother as well, because mothers are generally taking too much care for the cerebral palsy kid, but not taking care of themselves. So not only the kid, but the mother should go for a proper physiotherapy session, for the kid to improve the motor control, for the mother to improve the uh, flexibility. And once the flexibility is there, the stress management can be done along with that, right? If flexible body can move properly, and reduced flexibility is sometimes also causing more stress, right? So which physiotherapy modality helps to improve joint stiffness? Okay, joint stiffness is something which is not able, the joint is coming close, overweight, it is giving you osteoarthritis kind of things. Arthritic changes can be coming up because of lack of space, tightness, wrong posture. Okay, to reduce that, ultrasonic therapy is a machine of physiotherapy in which the ultrasonic waves are given to reduce the spasm, to reduce the inflammation. Stretching exercises are ones for flexibility, and manual therapy like myofascial release and everything again for relaxation. So the right answer is all of the above, right? So all of these therapies are sometimes helping in one or the other way to make that person get rid of their stiffness. And once the inflammation is reduced, the person is able to walk their limb. So to summarize, physiotherapy gives storage of your energy and restores your strength. It restores your mobility, your range of motion, your action, your independence is again achieved with the help of physiotherapy. So early intervention and consistency are the critical care in which in all are critically important for that person with disability. If that consistency is maintained, the person can again shift to disability to ability, right? Your posture corrections are something which everybody should take care of their posture, because right posture gives you more energy and less of your energy is wasted. आप जस्ट एक चीज इमेजिन करो कि अगर आप अपने घर से मेरे घर सीधी रोड पे आ रहे हैं तो पेट्रोल कम लगेगा, isn't it? If you're coming on one straight pathway, your petrol usage is less in the car, isn't it? But if you're going left and right, here and there, first I go to one place, then other place, then third place, then fourth place, then your petrol usage is more. अगर आप घूम घुमा के मेरे पास आ रहे हो तो उसमें बहुत सारा पेट्रोल यूज हो रहा है, isn't it? So same is our energy. If our posture is correct, अगर हम सीधे बैठे हैं, right posture is there, then our blood flow is proper and less of energy is wasted. And if a person is bent on one side, stooped on other side, then the blood has to travel here and there. So the person will feel more fatigue, थकावट, दर्द, ये सब चीजें आ जाता है, right? So you have to sit straight. If you are sitting straight, then it's fine. But if you are not able to sit straight, किसी के कहने पे सीधे बैठे तो क्या बैठे, isn't it? आपके मसल्स में इतनी स्ट्रेंथ बना दें कि आपको कहना ही ना पड़े सीधे बैठने के लिए और फिर भी आप सीधे बैठें, isn't it? अगर if we are telling somebody to sit straight, he will sit straight for 1 or 2 minutes. Again, he'll bend, isn't it? If we are strengthening that person without even asking, the person who was sitting cross-legged was sitting straight now. Okay, so that is what is physiotherapy, in which you don't have to say, but your action speaks, right? So this was a free camp from Sukija Physiotherapy team and Indian Association of Physiotherapy, Women's Cell, Sukija Physiotherapy Clinic team went to a disability school over where on the Children's Day. Now, recently in November, on Children's Day, we conducted a free camp for the people. Just have a look on this. We guided them how to go for a balance training, flexibility, balance, resistive training. So many things were taught: how to sit, how to support, okay, how to touch, how to put weight, what are closed chain exercises, open chain exercises. There are a lot of things to be taught. So this was a camp. This was also free of cost, conducted by our team to help the people with disability. Thank you so much. With this, we'll end up this today's session. You can join me on Instagram. You can always subscribe my YouTube channel to be in touch, and do comment in the comment box how you liked it. It gives us energy to conduct again the free talks and free webinars and go for some awareness sessions. Please do write in the comments how you liked it, and I'll be glad to help you out in any kind of pain, problem, stress, and even women health. I am working into women health. I want every lady to be pain free, no pain in periods, right? And for that, you need to know what kind of physiotherapy you should do, right? How to go for all the rehab in urinary system, bladder training, and even orthopedic pains and neurological cases. You can always refer to my clinic in Sukhija Physiotherapy Clinic. It is in Mohali, Punjab. And last but not the least, I want to thank all the IAP members, Dr. Ruchi, Dr. Divita, the whole team of Indian Association of Physiotherapy, and IAP Women's Cell, Dr. Mandeep ma'am. There are so many people. If I say, the list will not end so soon. But thank you everyone who boosted me up to talk on this disability today. And do subscribe my YouTube channel and be in touch. I'll always help you out. Thank you so much for being with me. That's how we'll end this. Any doubts, you can always ask or write in the chat box. Okay. So you can always write to me in the chat box, in the comments. I'll surely help you out and answer you all. I hope this session was fruitful, and thank you for being with me.